Hi, Austin Lawrence here from Get You Back on Track. Today I'm going to talk about a lateral pelvic tilt. Now it's not quite as common as an anterior tilt, but I still see it in a high number of clients that come to see me with back pain. So as you can see from the picture, one side of the pelvis is higher than the other. Now a lot of people think, or they've been told, that they have a leg length discrepancy, but more often not, it's due to a muscle imbalance between the muscles around the lumbar spine and pelvis. Just like with anterior pelvic tilt, some muscles are going to cause it to happen and others are going to allow it. So the muscles that cause it to happen are tight adductors or groin muscles on the high pelvis side, and tight quadratus lumborum or QL muscles for short, and lumbar erectors on the high side. Some muscles are going to allow it to happen, so you find weak hip abductors on the high side, so muscles that move the hip out tend to be weak, and weak QL and lumbar erectors on the low side. At the lumbar spine, the facet joints on the high side become compressed as they move together. This can cause further pain and dysfunction. More pain equals more inhibition. The nerves that supply the glutes originate this area, so the glute muscles can be inhibited. I often find people have a lot of sacroiliac pain when they have a lateral pelvic tilt. If a person's got an anterior pelvic tilt along with this, the compression on the high side is even worse and they suffer a lot of pain. How does this affect someone? Obviously a lot of pain. There can also be pain in the back on the low pelvis side as the muscles and the joint capsules are put on stretch. Often there'll be pain in the groin on the low side because the groin muscles are put on constant stretch. Hip joints are affected, so you lose hip mobility. As I mentioned in my previous video, if you lose mobility at the hips, the spine or the lumbar spine has to make up for that mobility, and the lumbar spine is meant for stability. So when it compensates, you get more pain. You also see people squat, or when they squat, the knee on the low side tends to cave in. To correct it, you need to inhibit the tight, overactive muscles via static stretching. You can activate the weak, inhibited muscles, or the muscles that are on the low side, using isometric exercises. That's lateral pelvic tilt, what it does, and what you can do about it. Thanks for watching.